Hello, in this part now you're going to visualize the investigation of stroke. Is it clear? So in order for you to speak about the investigation of stroke, you need to still put it in the element according to the SchrDbb. Is it clear? So I'm going to bring out again the algorithm according to SchrDbb for you to visualize how to classify your investigation. So when you want to have your investigation in place, you still use the algorithm according to SchrDbb. You start with the disease, then you go up to the you investigate first for the disease, you rule out the differential, and then you rule out the endemic disease. Then you investigate the cause. Is it clear? Then the next one to investigate, you investigate for the complication of stroke, you investigate for the background of the particular stroke you're speaking about, and then you investigate for the prognosis. So those are the different elements that you need to investigate. Is it clear? Now, the first element that you have to investigate is to investigate first for stroke. So investigate for stroke. What are the elements that you have to visualize? So the first one is to investigate the disease that is at the middle. Is it clear? And to rule out differential. So you need to know that what generally the differential diagnosis of stroke is stroke. Stroke is a diagnosis on its own. The only differential diagnosis that can be taught in stroke is a cerebral venous thrombosis. That is the only differential diagnosis that can be taught in stroke. But cerebral venous thrombosis generally is very rare. Is it clear? When you have thrombosis of the cerebral veins resulting to an edema located at a particular part of the brain, which can herniate and result to a focal neurologic deficit. Is it clear? That's the only differential diagnosis of stroke. But generally, the differential diagnosis of stroke is stroke. If it is not ischemic stroke, the differential diagnosis is going to be hemorrhagic stroke. Apart from that, you may have also a cerebral venous thrombosis. Is it clear? So those are the different elements that you need to bring out. So you rule out the differential diagnosis and then you rule out the endemic disease. The next thing is you investigate now for the cause. Is it clear? For stroke. Then you investigate for the complication of stroke. Then the next one, after investigating for the complication of stroke, you investigate for the background. Is it clear? You investigate for the background. And the fifth one, you investigate for the prognosis. Is it clear? So those are the different elements that you have to note. Is it clear? Now, investigating the disease. So those are the different elements that you need. So all this is making up the goals of investigation according to SchrDbb. You have the goals of investigation. Is it clear? Now, after the goals of investigation, you need to know that what this first goal, which is investigating the disease, ruling out the differential diagnosis and the endemic disease, is going to use the principle. This first goal uses the principle of investigation. Is it clear? So this first goal here uses the principle of investigation. And what is the principle of investigation? Principle of the investigation says that what? In order for you to investigate, first start by supporting before confirming. Is it clear? You support first before confirming. Is it clear? So generally those are the different elements. So for only this particular 1 year for the investigation of the disease, you first start by supporting, then confirming. But for these other ones here, which is investigating the cause, the complication, the background, the prognosis, you just say that what there are means of investigation, and means of investigation is divided into two. You have laboratory means of investigation, and then you have radiologic or imaging means of investigation. Is it clear? So those for this you now use the means of investigation. So now, how are you going to visualize this? So we start with the first part. The first element is investigating the diagnosis. So your diagnosis here is stroke. And in order for you to investigate stroke, or which is the diagnosis, you need to use the principle of investigation. Normally, the principle of investigation starts by supporting the diagnosis of stroke, then confirming the diagnosis of stroke. Is it clear? So you need to know that what diagnosis of stroke, we don't need to support diagnosis of stroke. We support the diagnosis of stroke by clinical evaluation. Is it clear? Clinically, we can support the diagnosis of stroke. There is no investigation that is needed to support the diagnosis of stroke. The diagnosis of stroke is made clinically. Is it clear? And now to confirm stroke, is it clear? To confirm stroke, we now use a CT scan without contrast. Is it clear? To confirm stroke without use CT scan without contrast. Now the CT scan without contrast, why? We need to know that what the radio contrast materials causes spasms. Is it clear? Vasospasms or vasoconstriction. And if the patient have an ischemic stroke, the radiocontrast material causes vasospasm, and if the patient has an ischemic stroke, it's going to aggravate the ischemia, resulting to more umbral formation or more deficit. Is it clear? So that is why we don't use a radiocontrast material in a patient with stroke. Is it clear? Another reason why we don't use radiocontrast is that what patient that has ischemic stroke are going to, so ischemic stroke is going to appear hemorrhagic because the radiocontrast is going to be whitely stained. Is it clear? It's going to show a hyperdensity. Is it clear? That's the second reason. The third reason is that what the radiocontrast is toxic. Is it clear? And in the case of a hemorrhagic stroke, the radiocontrast is going to spill out in the brain cell and result to damage to more tissues. And the fourth reason is that usually radiocontrast is in old age patient, and old age patient usually the stroke occur in old age patient. Old age patient may have a renal failure that may result to decreased elimination of the radiocontrast from the body. But the most important reason is that what radiocontrast material result to vasospasm that may irritate more and result to more ischemia, provided that the patient has an ischemic stroke. Is it clear? So that is how you make a diagnosis of stroke. Is it clear? Now, after diagnosis, you have to rule out the differential. The differential of stroke is what? Hemorrhagic stroke. If it's not ischemic stroke, it's hemorrhagic stroke. And you say with the